Hello and welcome back. Today we'll begin our journey in a three-part series on deciphering pharmacy SIG codes. So this first part will go through the first three elements of a SIG code translation. Part 2 will go and cover the last three parts, and in part 3 we'll take a look at estimated day supply and how to read the inscription. Deciphering SIG codes. Doctors will use shorthand when writing prescriptions, and it is the responsibility of the pharmacy technician to decipher it for the patient. So there's 6 elements, and you want to decipher them in that order: verb, number, dosage form, route, frequency, and additional information. Let's go ahead and describe the 6 elements of the translation. First is the verb. A verb is an action word. So some examples here: take, place, still, insert, apply. So we're always giving them some instructions with the verb. The next element is a number. So it's going to be the amount of drug to administer. You'll need to be able to recognize Roman numerals as well. For example, half would be SS with the line on top. Roman numeral 1. 1 1/2, 2, etc. Next is dosage form. Dosage form is how the drug physically comes. Common examples: tablets and capsules you're familiar with. Creams and ointments for topical application. Patch topical as well, and suppository for insertion. Route: how the drug is administered. In other words, how the drug enters into the body. So by mouth, under the tongue, into the eyes, into the lungs through inhalation, or into the rectum. The fifth element is frequency. Frequency is how often the patient will be taking the medication. So for some examples, every day, 2 times a day, 3 times a day. Or if we want to evenly space them out, we can specify every 6 hours, every 8 hours, or after meals, before meals, or even with meals. And lastly, any additional modifiers that the doctor may want to add to specify the instructions to make it clear or give any specific information that they want. So here's an example of a SIG code: ITPOBIDPRN. So the code for the number is a Roman numeral. Sometimes you'll find Roman numerals are written in lowercase. The dosage form code is a T, route is PO, frequency is BID, and the additional information is PRN. So this will translate out to take 1 tablet by mouth 2 times a day as needed. And you can notice here that, well, it's empty for the verb code. So let's do another example. ICPOQHS sleep. So for the verb, even though there is no code, we can pick up from the previous one that anything PO by mouth, you're going to use the verb take. So for this SIG code, we're going to take 1 capsule by mouth every night at bedtime as needed for sleep. Notice that in the previous 2 examples, there were no verb codes. You will not be given verb codes by the doctor. Well, usually you won't be given any verb codes, and it's going to be up to you to determine the appropriate verb, the correct verb to use. And the first thing you want to look at is the route of administration. So for us, PO will always be by mouth, regardless of the dosage form. So if it's a tablet, we'll take by mouth. If it is a suspension, we'll take by mouth. A solution, we'll take by mouth. However, sometimes there may be some ambiguity as to which verb to use. In that case, you want to take a look at the dosage form. So initially, the first thing you want to look at is the route, and then secondarily, look at the dosage form. And then the dosage form will determine the correct verb to use. So let's go over some of the verb codes and the associated, let's go over some routes and their associated verbs. So mouth, we already went through. PO by mouth is take. SL stands for sublingually, but we want to translate it as simple as possible for the patient. So we'll make it under the tongue. And the verb in this case is place. So you don't want to use take under the tongue because the patient would swallow the medication, and that would be an incorrect route. BUC stands for buccal, and that is the pocket between your cheek and gums, just like nicotine gum would work. You chew the gum, place it between the cheek and gums, and the drug will absorb into your bloodstream. So the verb here is place, similar to SL. Again, if you tell them to take it, they may swallow it, and that would be an inappropriate route. Next, we have AA. AA specifies the affected area, and most of the time, it's topical, like skin infection. We'll apply a cream or an ointment. PR is rectally, and this one really depends on the dosage form. So if it is a suppository, then you want to unwrap and insert into the rectum. Vaginally, PV. Now, if it is a tablet for the vaginal route, then the verb is insert. However, the vaginal route can also have suppositories, so make sure you use the verb unwrap and insert. And there's also creams and ointments for vaginal use. In that case, you would use apply. OS, OD, OU. So O's are for the eyes, and if you speak Spanish, it'll be simple for you because eyes are ojos. And for left and right, I use a little trick. So we got the left side and the right side, and I'm here in San Diego, so we're San Diego. So if we have the S and the D's, it'll specify left and right for us. So in this case, OS would be the left eye, OD would be the right eye. And depending on the dosage form, if they are drops, you're going to instill the drops into the eyes. If it's an ointment, you're going to apply them to the eyes. And then OU is both eyes. The same convention for left and right in both is used for the ears. So in this case, AS is your left ear, AD is your right ear, AU is both. And similarly, if you have drops, you want to instill them. If you have an ointment, you're going to apply. The intravenous routes. We have IV, intravenous. That's going to go straight into a vein. And usually these are going to be in very large volume bags. That's your IV solution. That's the one that goes directly into the patient's arms. So that's IV. Since it's in a bag, we're going to use infuse. And the other infuse verb for the intravenous routes is going to be IV piggyback. So the IV piggyback, just like the name suggests, it piggybacks on the IV line. And since it's also in a large volume solution bag, the verb's going to be infuse. Next, we have IV push. So IV push, there's actually going to be a catheter site here where you can attach a syringe, and you're going to push the drug into the fluid stream, and then that'll enter into the patient. So since this is in a syringe, the verb's going to be inject. IM and SC will probably be more common than IDEP and IT. So IM into the muscle. We'll usually use a syringe for that administration. Same with under the skin. So an example of an IM injection would be the flu shot. An example of a subcutaneous injection would be insulin. So in the abdomen area, right under the skin. And then we have the three least common for us in pharmacy. ID for intradermal. An example of that would be the TB screening. That's also the purified protein derivative. Epidural. So we have 3 layers called the meninges covering our brain, helps protect us. So in this case, epi means right above. So we're going to administer the medication right above the meninges. And this one depends. Sometimes they're in syringes. Sometimes we'll have larger infusions that are in IV bags. And lastly, intrathecal. So this is going to be within pretty much the spinal cord. They're actually going to pierce the first meninges. They're actually going to push it through into the dura mater. And most of the time they're trying to withdraw some cerebral spinal fluid, aka a spinal tap. Roman numerals. I think we had half already. Yeah, so a lot of times you'll have a Roman symbol with a line over the top. So definitely for half, it's SS with a line over the top. And for Roman numerals, sometimes it'll be capitalized, sometimes lowercase, sometimes written in cursive, and then sometimes in cursive without the front tail on it. And then for numbers less than 10, a lot of times they'll put a line. So 1 kind of looks like 1 over 1 sometimes, or just an I or a T, but that's just a lowercase I with the line. They'll do it in cursive, put a line, or they'll leave out that front leg on the I. So kind of looks kind of weird. May look like a half or 2, but just notice they'll put a line over the top. For Roman numerals, you can have no more than 3 of the same symbols. So for 4, we won't be able to do that. That doesn't work. And if you have a smaller symbol in front, you'll need to subtract. So since I stands for 1 and the V is 5, you'll have to subtract the 1 from the 5. Same thing for 9. I is smaller than X, so you'll have to subtract 1 from 10. L is 50. Other ones we'll use C is 100. That's a century. I don't think we'll go any higher than that. Household units. You want to make sure you always use household units. If the doctor specifies 5 mLs, just go ahead and translate that to 1 teaspoonful for the patient. Something that they're familiar with. An old apothecary unit is the dram. So it's dram for us, it's going to be the same as a teaspoon, 5 mLs. If you have 2 teaspoonfuls, then that's going to be 10 mLs. And notice the spelling. You want to put the S after the N. Your spell checker may not like it, but that's the way it should be in pharmacy. So teaspoons were the small spoons. For the large spoon, we have tablespoons. That's going to be 15 mLs. So you can see already that you get 3 teaspoons for every tablespoon. 1 ounce, 1 fluid ounce for us is approximately 30 mLs. So when deciphering for a patient, we'll tell them to take 2 teaspoons full by mouth. Let's take a look at some dosage forms. These are probably the easiest. Most of them are just abbreviations of the English word for the dosage form. So tablet, which you're familiar with, pill made from compression. Capsule usually encased in a gelatin shell. Solution, anything liquid. That's kind of a generic designation. Syrup, a lot of sugar, high amounts of sugar. An elixir, still a solution, clear solution, but it has sugar and some alcohol in it. Suspension, liquid formulation, semi-solid, where you'll have solid particles not completely dissolved. Suppository, bullet shape, dosage form, designed for insertion. Drops is GTT, so here's the first one. That's not an abbreviation of the English word. Ointment is the second one, UNG. Cream, lotion, and applicator. So for the two that are look-alike, sound-alike, would be SUSP and SUPP. So everything else, they're fairly unique. Looks like let's do some practice. So for this one, we're gonna just do the first four elements: verb, number, dosage form, and the route. So PO, the verb code, is always going to be take. So we'll just take 2 tablets by mouth. SL, under the tongue. So we don't want to take under the tongue. The verb for this one is going to be place. So in this case, we'll place 1 tablet under the tongue. ITSP, SYRPO. So this is the syrup. You don't have to mention the dosage form again, because kind of the teaspoon would be your dosage form. So PO, the verb will be take. We're going to take 1 teaspoonful by mouth. (15 mLs). PO, we know the verb is take. What is the household unit for 15 mLs? Is that the big spoon or the small spoon? If you said big spoon, you'd be correct. So we would take 1 tablespoonful by mouth. And again, you don't need the dosage form. It's kind of redundant since you have teaspoonful. BUC, buccal. The buccal pocket is between the cheek and gums. Do you take? No, we're going to place 1 tablet between the cheek and gums. AU. Are those eyes or ears? Well, if I speak Spanish, I know my ojos are my eyes, so these must be the ears. And San Diego is left and right, so the U would indicate both. So for drops into the ears, we're going to instill 2 drops into each ear. You can say instill 2 drops into both ears if you like. OS. So ojos for eyes, and then San Diego, that's going to be left. So that's left eye. Drops, we're going to instill. Instill 2 to 3 drops into the left eye. Ointment OD. So here I just put in the dosage form to test if you can come up with the appropriate verb. So for ointments into the right eye, we are going to apply. Apply ointment to the right eye. And yes, you can apply ointment to the eyes. Newborn babies, when they're first delivered, they'll put in an antibiotic ointment into their eyes. Suppository, into the PR. So that's rectum. So for suppositories, you got to remember to tell them to first unwrap. So we'll unwrap and insert 1 suppository into the rectum. A few more examples. PV, vaginally. So for tablets for vaginal use are called inserts. That kind of helps you out. So the verb is insert 1 tablet into the vagina. Ointment into the vagina. Applicator. So ointment we normally apply. So we'll apply 1 applicator full into the vagina. And conversely, you can use insert You can use insert the contents of one applicator into the vagina. So if you go that route, you're just going to use applicator. Here, we're applying the contents of the applicator. DR, so that's not drops. Drops are GTT. So DR is dram. Yep, so 1 dram is similar to 1 teaspoon, so a small spoon, and I put here solution. So PO, we're going to take 2 teaspoonfuls by mouth. And remember to add the S after spoons. All right, that concludes part 1 of SIG codes and Decipher. So make sure you make flashcards for all the abbreviations so far. Try to commit them to memory, and the list that I give you is not fully exhaustive. So there may be some assignments where there are SIG codes that aren't included here. Just go ahead and try to research them. And if you can't find them, then let me know and I'll help you out. So once again, thank you for joining us. And I'll see you next time. SIG codes part 2. Thank you and have a good day.